Health authorities in Central Africa are intensifying efforts to contain a growing Ebola outbreak in Eastern Democratic Republic of the Congo, as neighbouring Uganda steps up surveillance following imported cases linked to the virus. Emergency treatment centres are being prepared in DR Congo's Ituri province as the World Health Organization declared the Ebola outbreak an international public health emergency. Africa Centres for Disease Control and Prevention says at least 336 suspected and confirmed infections and 87 deaths have been recorded so far in the country's 17th Ebola outbreak since 1976. Health teams are working in Bunia, Rwampara and Mongwalu to isolate patients and trace contacts in a region already struggling with insecurity and limited healthcare access. DR Congo's health minister urged residents to seek medical help quickly.
The sooner we take the patient in for care, the sooner we treat them, the sooner we will stop the movement, what we call the spread of the virus. So this is not a mystical disease. Make yourself known. Make yourself known so that you can be taken care of and so that we can prevent the disease from spreading. That is really the message. Treatment is free. Come and get treated.
Regional concern has also spread into Uganda, where authorities confirmed a fatal imported case involving a Congolese man who had travelled to Kampala. The World Health Organization warns that cross-border movement and weak surveillance systems could complicate containment efforts. Some residents fear the outbreak could disrupt travel and daily life, while others called for stronger awareness campaigns and preventive measures.
It creates a challenge with the travel element because then Uganda lies at a risk of facing a travel ban, and for a person like me who is engaged in travels here and there, if we are put on a travel ban, very many things in the background get disorganized and it is not good for the country as a whole. I would like the government to, one, quickly spread awareness about Ebola and how it is spread, to break down this information even for the layest of people to understand, but also start to institute measures to avoid the spread of Ebola in Kampala and Uganda as a whole, so that there is a feeling of safeness, of security against this disease of Ebola.
Someone who works in Kampala, I didn't receive well the news of Ebola outbreak in Uganda because I work in an environment where I meet many people every day. So it puts me on a high risk of getting also Ebola.
Health authorities across the region say surveillance, contact tracing and public awareness efforts are now being intensified as officials work to prevent the outbreak from spreading further beyond eastern DR Congo and Uganda.